March 14th, 2020 through May 14th, 2020. It's exactly 2 months after the first case of the deadly coronavirus pandemic was confirmed in Rwanda. The first case in Rwanda was confirmed 3.5 months after the foremost case had been reported in the Chinese province of Wuhan, widely believed as the epicenter of the COVID-19 pandemic outbreak. Since that time, response measures to the virus have been changing every other day as new information continues to emerge. The analysis and research of the virus has not left the health sectors in Rwanda the same, says Dr. Nsanzimana, the Director General of Rwanda Biomedical Center.
Mu ntangiriro z'icyorezo nta wari uzi yuko n'umuntu umwe ashobora kwanduza undi. Nyuma biza kumenyekana.
From the beginning, we did not know how the virus was spreading. We reached a point of tracing every asymptomatic person. The third phase was to establish if someone without symptoms would infect others. We reached various conclusions based on the research and the data received. That has revealed to us that the situation in Rwanda is totally different from anywhere else as opposed to what we presumed. For instance, most of the cases in Rwanda were not asymptomatic. Yet the information we had from China is that half of the confirmed cases were asymptomatic. This shows that there is a difference on how the virus has affected people across continents and countries. But that is a trend we are still examining.
Ibyo byose ni ibintu tugenda twiga umunsi ku wundi.
Over the past 2 months, no death has been reported in Rwanda, despite registering 287 cases, while over 160 people have recovered from the virus, representing 57% of all confirmed cases so far. About 120 people are still being treated in isolation centers. As of May 13th, 45,000 people had been tested for the coronavirus in Rwanda, with just 0.6% testing positive. In the last 10 days, 44 people have tested positive and 80% of those are imported cases. The virus has killed nearly 300,000 people worldwide, with over 4 million infections, according to World Met account on Thursday, May 14th. Dr. Nsanzimana says that early detection and isolation has helped Rwanda to prevent coronavirus death.
Natwe twari bafite za diabete, bafite umuvuduko w'amaraso, bafite.
We had coronavirus patients with non-communicable diseases, such as diabetes, high blood pressure, and other respiratory diseases. Now the question you can ask yourself is how have we managed to prevent death under such circumstances? Early detection has helped us to treat symptoms before the immunity of the patient has been weakened. Some patients required oxygen as a precautionary measure to support the respiratory system before it was too late. The second thing is that patients were put in isolation to contain the spread of the virus. Treating symptoms helps the immune system to defeat the virus normally and faster.
Icyo gihe virusi umubiri urayisohora bisanzwe.
Over the past 2 months, Rwanda has gone through 2 phases of fighting the pandemic. During the first phase, the country went into 40 days of total lockdown, while the second phase has seen a lifting of the lockdown, but still some restrictive measures, such as restricted movement between provinces, being observed to contain the spread of the virus. Minister of Health, Dr. Ngamije Daniel, explains why the government adopted the partial lockdown.
We don't have community transmission of COVID-19 among population. Clearly, patients that we had so far were in majority imported cases with local transmission they made among their close contacts, and all of them were in quarantine site and treatment centers. So for us, it was clear that there is strong reason to progressively phase out the lockdown.
Since the lifting of the total lockdown, wearing face masks has become mandatory, not only for essential workers and medics, but also for everyone in public to control the spread of the virus. Reporting for RwandaTV News, Athan Tashobya.